Ever feel like you're standing right on the edge of something massive? Like something huge is about to happen?
Yeah.
That's what we're talking about today, because we are diving deep into this world where DIY diabetes tech
Mm.
meets these like cutting-edge medications.
Right.
And you're here with us. So,
Yeah.
okay, so imagine this. Imagine if you could build your own system that manages your diabetes.
Wow. I know, right?
It sounds crazy, but that's what's happening right now with open source automated insulin delivery systems.
Yeah. Open source aid for short.
Yeah, open source aid.
If you want to be cool,
That's right, that's right.
gotta be cool.
So we're talking about people taking charge of their diabetes in a way that we haven't really seen before. Like they're fine-tuning algorithms,
Yeah.
customizing their insulin pumps.
Really pushing the boundaries here.
They really are. It's incredible. But this is a really wild part. Into this world of like DIY diabetes tech, now comes another like potential game changer. GLP-1 receptor agonists. You might have heard of these.
Yeah.
Maybe you know them by names like Ozempic or Mounjaro.
Right.
Initially, they were for type 2 and for weight loss, but now everyone's talking about how they might be huge for type 1.
Yeah, absolutely. And we've got our hands on some early insights about this.
We do.
So think of it, this isn't a large clinical trial or anything like that. Think of this as like a sneak peek from
Yeah.
people who are already in the thick of it.
Yeah, the early adopters.
Early adopters, they're already using open source aid, and they've started incorporating GLP-1s into how they manage everything.
So we get to see like what's working, what's not working before it like hits the mainstream.
Exactly, exactly. So this study we're looking at, they asked open source aid users all about their experiences using GLP-1s. They did it through an online survey, just so everyone knows, it's a smaller study.
Right.
And it relies on people, giving their own experiences, their own data. So are the findings interesting? Yeah. Do they need more research? Absolutely.
Okay.
But still interesting.
Absolutely. So let's get into these findings because, whoa, one of the biggest things that we saw here was this massive impact on how much insulin people need every day.
Yeah, huge, like a 45% average reduction.
That's almost half.
Think about that, cutting your daily insulin almost in half. I mean,
Yeah.
that's not just about fewer injections. It could mean a lower risk of all those long-term complications. I mean, that's a big quality of life improvement we're talking about.
Absolutely. Absolutely. So, okay, what about this idea of like set it and forget it? Diabetes management.
Oh, yeah, yeah.
Because almost 60% of the people in this study said they needed fewer or even no manual adjustments for meals.
Yeah.
Like, is this the future?
It seems like we're moving in that direction.
Oh, wow.
And this kind of ties into some of these open source aid systems. They have this really interesting feature. They call it unannounced meal handling.
Mm-hmm.
It's kind of wild because the system can actually detect these surprise rises in your blood sugar, like if you have an unplanned lunch
Oh, right.
or something like that. And it can adjust your insulin even if you don't log the meal.
So it's like having an AI co-pilot for your diabetes.
It's wild. It really is.
It's true. But we always have to look at both sides, right?
Absolutely.
Right.
So while some people had these amazing results like better blood sugar, less hunger, some people even lost weight, there were some downsides that people reported to.
Yeah, and that's where it gets even more interesting. Some people mentioned that they had increased ketones,
Okay.
especially after they fasted. Now, ketones, like you're probably wondering, what even are ketones?
Right.
Yeah.
For sure.
So basically, they're your body's backup fuel. So when you're not getting enough glucose,
Yeah.
like if you're fasting,
Right.
your body's like, okay, well, we got to get energy from somewhere.
Mm-hmm.
So it starts burning fat instead. And that process, that makes ketones.
So ketones aren't necessarily always a bad thing then? Exactly. Not at all, actually. It's actually like one of the ways that these medications can help people lose weight, but it's definitely a balancing act. Like you don't want to go too high.
Yeah.
Because if your ketones get too high, it can be a risk factor for DKA, diabetic ketoacidosis.
And that's something you really want to avoid.
Yeah, you really do. And it's worth mentioning, this study didn't find that these higher ketone levels were like directly leading to more DKA cases or anything like that.
Mm.
But it's definitely something to be aware of. It's just it highlights how important it is to, keep a close eye on things, work with your doctor, all that good stuff.
Yeah, for sure. More research is needed there for sure. So another thing that was mentioned was like people having a harder time recovering from lows. from hypoglycemia. What's the deal with that?
See, this is where GLP-1s get even more interesting. So, like, your body already has this awesome system for, like, rescuing you from low blood sugar, right?
Yeah.
So when your blood sugar drops too low, your pancreas, it releases glucagon, which tells your liver, hey, dump some of that stored glucose back into the bloodstream.
Like a quick boost.
Exactly.
Yeah.
Exactly. But here's the thing with GLP-1s. They can actually slow down how quickly your body releases that glucagon. So it's almost like your backup system, it's running a little slow.
And then on top of that, they can slow down digestion too, right?
Exactly.
So even if you like treat with some fast-acting carbs, they might take a little longer to like actually work.
Exactly. It's like a double whammy.
Wow.
And this is why like personalized care is so crucial.
Yeah.
Because what works for one person might not work for someone else at all. You know what I mean?
Right.
And managing diabetes with these medications, it takes, careful monitoring and working with your doctor to adjust your treatment plan as you go.
Yeah. Doesn't sound like this is a do-it-yourself kind of thing.
No, not at all. I mean, this is all about, arming yourself with information, but it is not a replacement for, talking to your doctor.
Yeah.
Someone who knows your medical history.
Right. Okay, so we've talked about how this can like change your insulin needs, this whole set it and forget it thing. And then some really important things to watch out for, like ketones and how you bounce back from low blood sugars. But I got to ask, there are a lot of people listening right now who are thinking about, what about carbs?
Oh, yeah, sure. Yeah, that's a big one. And it's something we hear all the time. Like, can I still eat carbs if I'm taking this? And the good news is GLP-1s, they might actually make it easier to handle those carb-heavy meals.
Oh, okay.
Yeah, remember how we were talking about them slowing down digestion?
Yeah.
So that slower digestion, it can be really helpful when you're eating carbs because it helps prevent those, like, really rapid spikes in blood sugar that you might get after a meal.
So it's not that you had to totally ditch, like, your favorite pasta, but it might make it easier to stay in range after you have some.
Exactly. And then on top of that, they also seem to help your body, like, respond to insulin better.
Yeah.
So you might even need less insulin overall. It's like you get this, like, double dose of support.
It's amazing. Okay, so this is all, like, super promising, but it's still early, right? Like, what needs to happen before we see these medications more widely used for type 1?
Yeah, it's definitely still early days. We definitely need those like longer studies to really confirm these initial findings and to get a clear picture of, the benefits, but also like any potential risks long term.
Right.
We need to figure out like the best way to actually integrate them into like the treatment plans that are already out there.
Definitely not something to just like try on your own.
Oh, no. This is a talk to your doctor kind of thing, ask questions, stay informed. But here's what I think is really fascinating about all of this. It's not just about like changing insulin doses. It's actually making us like rethink how we approach treating lows altogether.
Okay, now I have to know more.
Well, think about it. We've seen that they can make people more sensitive to glucagon, right? So what if, like, instead of grabbing the juice or the glucose tabs when your sugar's low, you could just take this tiny dose of, like, nasal glucagon?
Like a quick, like, targeted boost.
Exactly. It's a really interesting possibility, and it just shows how fast this whole world of diabetes management is changing.
It really is. We've gone from like building your own diabetes tech to maybe a future of microdosing glucagon, all in one deep dive. It's incredible. Well, that's it for today's deep dive, but we want to hear from you. What really stuck with you? What are you thinking about after this conversation? This is definitely just the beginning of the GLP-1 story. We are so curious to see what happens next, so keep learning, keep those questions coming, and keep on diving deep with us.